Hello, my name is Mabel Crescioni, and I am the instructor for Law 575A Clinical Research Ethics course. And I would like to share a little bit about this course. I'm currently a senior engagement officer at the Patient Centered Outcomes Research Institute, where I support principal investigators and their teams who have been funded by PCORI. Um, and I support them and provide technical assistance in how they do their engagement. So that ultimately is how they work with communities, how they bring in the patient perspective and incorporate that into the not only the research questions, but also the design of the study and the strategies that are used for recruitment and for other types of engagement of patients throughout the life cycle of the study. And so um, I sort of got here on a whim. It didn't have a linear path, and I think um, that's a really important piece of this work, that understanding that there isn't necessarily a linear path to getting to where you want to go and to getting to a place where you find work that is meaningful, engaging and exciting. And so before I went to PCORI, I was at the Critical Path Institute, and many of you may be familiar with that organization. And I worked at CPATH for a few years, and I worked in the patient-reported outcome team and the clinical outcome assessments, which eventually evolved into the clinical outcome assessment team. And at that point in time, that then led me to work with patient advocacy organizations and getting funded by PCORI and developing and cultivating those relationships with PCORI staff and teams, and that ultimately then led to being in the role that I am today. Starting out as faculty in the College of Medicine, I learned a lot about clinical research, even though a lot of my training was in public health. Um, I learned a lot, and it was came very easy to me because of my background in law and policy. And so I think as you prepare to embark in this process of getting your health law certificate and thinking about which courses to take, um, you think about the fact that, this is more of a system, and how all the pieces are connected may not be necessarily obvious to you immediately, but it does all come together in the end. Um, my interest in teaching this course was really born out of the work that I was doing at CPATH. And at that time, I knew that the law school was interested in starting this program, and I was interested in figuring out how to combine that regulatory experience that I was developing and working with FDA, a lot of the work that we were doing in developing these clinical outcome assessment measures that were being used for drug development and up eventually, and how to combine that with my legal and my policy background. And developing this course on clinical research ethics seemed like a very good fit. It seemed like a very logical progression of the work, and a really important component of understanding how does the law and the research fit together, and how does the policy fit with that. And so as we think about as we thought about the topics that this course should cover, we knew that it was important for the course to cover not only the institutional review boards, not only all the topics related to human subjects and the regulations in the United States, and all of the international documents that have been developed around human subjects protections and how those are applied, but also that we needed to think about what were some of the emerging issues around clinical research and ethics. And so, as you embark in this course, you're going to see that we're going to spend quite a bit of time, initially in the first couple weeks, covering a lot of that material, and understanding how the Human Subjects Protection Program in the U.S. functions, and if you are a researcher within the University of Arizona or embarking in a path to do research, what are some considerations for you? But we're also going to talk about other topics such as conflict of interest, animal testing, big data, and issues around that. And so, a lot of the objective of the course is not really to help you understand those issues in depth, but it's really to help you develop a framework on how to think about these issues. And so we're going to spend a lot of time applying ethical frameworks to emerging issues. And so that's really what the objective of the course is. I always tell students that I'm not here to teach you what to think. I'm here to support you in learning what are the tools that are available for you to be able to think through the problems that you're going to face. And so many of you as adults that are already work in the workforce um, are not necessarily probably encountering many of these issues and would probably be best supported in being given tools and resources to address those issues, to figure out how to address them, to figure out how to think through them, and to figure out how in the end you get from a problem to a solution that is framed from an ethical perspective and that is framed from the perspective of how human subjects regulations and research regulations are applied in this country. So we are, like I said, we're not going to teach you specific things about emerging issues, but we're going to focus on how do we think about these problems and how do we face them and how do we work through them. And so, as you think about the expectations for the course, that is really ultimately what we're going to focus on. In terms of recommending who would take should take this course, I think this course can be for law students, it can be for researchers. So whether you're doing a graduate degree at the pharmacy school, at the nursing school, public health, if you're in the College of Medicine, any of you would benefit from understanding because as researchers, you will have to abide by these regulations. You will have to submit applications to IRBs. You will have to engage with that segment of our research community. And so the more tools and resources that you have and the ability that you have to speak that language, it's going to be very useful. And I think as a law student, one thing or some of the other types of degrees that are available at the law school, it would benefit you because you might be encountering even advising, an institutional review board or advising a committee that is overseeing research or some sort of data oversight committee. All of those organization types of groups that come together within an organization would benefit from the support of either an attorney or somebody who knows the laws and the regulations. And I will tell you from my personal experience, having worked for a health system where I helped establish and set up the institutional review board. It was really critical for me to be able to understand the framework for human subjects protections in the United States to be able to do that kind of work. And so, if you are a student at the law school, this will certainly expand your understanding of that regulatory framework.